Joining us now is OCTA Research Fellow, Professor Guido. Good morning, Professor. Thank you for being with us today.
Hi, good morning, Ria.
Now, as I said earlier, the Delta variant, it's now in 13 out of 17 regions. And that's why the health department says that the Philippines is now back under the high-risk category. How would you compare the situation now with the previous surges that we've seen? How much more serious is this, and are we already seeing the worst of it?
Yes, Ria. This is very serious. Even comparing it with what happened last March, the reason is that when we had the surge in March due to the Alpha and the Beta variants, it was primarily in the NCR. In fact, when we reported 10,000 or up to 11,000 cases in March and April, 94% of those cases were in NCR plus within the NCR plus bubble. So the difference now is that this is not just in the NCR, but it's happening all over the country. I mean, of course, the situation in the country is different. Some are plateauing, and some are just starting to have the surge. But the situation is that it's more widespread now, and containing the virus, this very infectious virus, which is the Delta variant, should be our main priority right now.
Okay, well, we're on day 5 of this 14-day ECQ in Metro Manila. What are the effects that we're seeing of this lockdown, or is it too soon to see that? But in any case, do we expect the numbers to be going down, or at least not increase over the next 2 weeks?
Well, Ria, based on what happened in the past, in the March surge and also the August surge, the effect of the lockdown will not be immediately felt. In fact, there's a possibility that cases may still rise a little bit, but the important thing is for the reproduction number to start decreasing. As of yesterday, the reproduction number in the NCR is 1.79, and as I mentioned in my talk in the PAASE, which is a Philippine American Academy for Science and Engineering, the lag time is usually about 3 days before we see the effects of the, for example, of the ECQ. So as of Saturday, we reported that we had the highest number of cases in one day in Metro Manila at 2,800, which is the highest since May 2. But since then, the cases have dipped a little bit. So it could be that we're starting to see the effects of the ECQ because cases are slowly stabilizing. But again, it's too early to make a generalization based on this.
All right, I want to talk about the situation in the regions. What provinces do we need to be watching closely? Because we're hearing of surges in places like Tuguegarao.
Right. Well, yes, Tuguegarao is definitely a place that we should monitor closely, and also in parts of Western Visayas, we heard about them lacking equipment to deal with the patients. Of course, Central Visayas in Cebu City, they're having the worst surge. Their current surge now there is worse than what it was last March and February, and we can actually see the effects of that. And of course, here in the NCR, not just in the NCR, but also around the NCR, in Bulacan and in Cavite, we're seeing rapid increase in cases that I think should be addressed soon. Because even if we're able to control the surge in the NCR, which it looks like we may be doing it now because of the ECQ, we still have to really control the surge in these provinces, Bulacan and Cavite, especially because they're adjacent to the NCR.
Right. That being the case, Professor, what else can the government do to stop this possible dramatic increase in cases, and also so that the healthcare system doesn't get overwhelmed?
Well, at this point, the government has basically done what it can, I mean, of course, it can look into recommending more strict quarantine restrictions in some of these places that haven't been placed under ECQ, for example. I mean, these are just options for the national government. And having bubbles would actually be very useful. It proved to be very effective last March around the NCR plus, because what that did was it contained the pandemic entirely within the NCR plus, but now it's all over the country. So having bubbles would help prevent it from getting to some of the countries which have, some of the provinces which have not been really impacted yet, because we don't want the Delta variant getting into every place in the Philippines, because it is very, very contagious. So right now it is really up to the national and local governments. They can do localized surgical lockdowns, but it's also really up to the Filipinos, to us, to help each other and battle this pandemic by doing our part.
Absolutely. But before I let you go, Professor, I want to touch on the planned House probe into OCTA. Your group is standing firm in your methodology for analyzing data and predicting trends in cases. Lawmakers want to understand this method better. Do you think that the probe is necessary and timely?
Well, as I mentioned, Ria, just yesterday we had a forum. It's called under the Philippine American Academy for Science and Engineering, and some many very well-respected academicians, scientists, researchers, and doctors were present there, and we presented our methodology given the time frame, and this was what I believe was a good venue for peer review, where peers, what that means is those who specialize in the same field in pandemic modeling, mathematics, in data science, they're there to scrutinize and evaluate our model. That being said, we're prepared to defend our model if need be, to the House of Representatives. So when we do get the call, I mean, we'll be there.
All right. Thank you for your time this morning, OCTA Research Fellow, Professor Guido David.